Deputy Simon Harris.
Thank you very much, Laskin Gurla. And I want to begin by sincerely thanking all deputies, regardless of their perspective, who contributed to the second stage debate on the Health Regulation and Termination of Pregnancy Bill 2018. I think we've had a good debate. I resent any implication when I hear people talking about rushing this. Anybody who wanted to speak on this bill had the opportunity to speak. In fact, some people who stood up last night and said we were rushing this didn't actually use their entire slot that was actually available to them. So after 35 years of the 8th Amendment and the damage that it's done to countless women, their families and Irish society, and providing adequate time for everybody to make their views in what is a wide-ranging second stage speech, I think this has been.
Everybody had an opportunity, and I'm not going to listen. No interruptions. You'll have other opportunities at later stages, but Deputy, the Minister without interruption. And I will treat everybody the same. So please, no interruptions.
Well, thank you very much. Thank you very much, Laskin Corley. So just making that point that everybody has had ample opportunity, as is right and proper in this House, as the people's representatives, to give their views. And I want to thank all deputies for giving those views. I also want to make the point, though, that it is 146 days since the people of Ireland voted to repeal the 8th Amendment. And what has happened in that time is important we don't forget either, because we know that every day around 9 women leave our country to go abroad to access termination. Women in crisis looking for help that can't get that help in Ireland today. And we know equally each day in this country about 3 women will take the abortion pill obtained online without any medical supervision or advice. So that's roughly 12 women every single day since the referendum passed, who have continued to have to access termination in either dangerous circumstances or circumstances where they've had to go abroad. As we've the luxury of sitting here in this House today, there's 9 women in the airport, at the ports, heading off to the UK or other jurisdictions. So that means 1,752 women in Ireland, Irish women, our mothers, our sisters, our wives, our neighbours, our friends, have had to access termination since the people of Ireland have voted to repeal the 8th. So whilst we have a job to do, an important job to do, to make this, as Deputy Burton so rightly says, the best possible bill that we can pass in this House, we also have to be conscious that the reality of women in crisis pregnancy continues today, and that until we pass the legislation, the instruction that the people of Ireland gave us to get on with it and do our job is an instruction we have yet to fully fulfil. Only this week I received a very heartbreaking email from a woman with a fatal fetal abnormality during her pregnancy, a desperately wanted baby, pleading with me to see if I could do something to help her husband, to ease what is already such tragedy and pain. And the reality of the situation, the harsh reality of the situation, is until this legislation passes, we are not in a position to do that. So I don't want anybody, I suppose, to kind of sit in here to decouple that, to decouple the fact that yes, we cannot decouple the scrutinising that we need to do with the reality facing women today, and with the story of that woman today sitting at home knowing that even though the people have voted to repeal, she'll still have to travel abroad because doctors who want to help her here, who really want to help her, can't do it until we pass this legislation. I noted a number of deputies say, quite correctly, that yes, the people of Ireland only voted on the question of repeal or do not repeal the 8th Amendment. That was the question. Of course, the chairperson of the Referendum Commission was right. I think I said it myself on a number of occasions. So the people voted to repeal or not repeal the 8th. That was their decision. But they did vote in the context of knowing what legislation I would stand up here and introduce if they voted to repeal the 8th Amendment. And in fact, the people who campaigned against the referendum highlighted elements of that bill, put elements of that bill on posters, in my view often distorted elements of that bill. And we had debates in television studios, radio stations, community halls. We had literature from both sides, all about the content of that draft legislation. So yes, it's accurate to say the people's decision was repeal or not repeal. But it's also important to say that the people made that decision in the context of a debate, a very detailed debate, following on from the excellent work of a cross-party committee and the excellent work of the Citizens' Assembly. So the legislation that we're bringing forward now is not a surprise. It is the grounds that we promised to do. And what I have said, and I really believe this, I think there's an onus on me as Minister. I would argue there's an onus on all of us in this House to legislate within those parameters. And I'm sure there's some people on both sides of the argument who will want more changes and the likes, and indeed we should consider each and every single amendment. That's our job. But I will approach this debate from the point of view of feeling a huge responsibility to introduce a bill along the lines of what we promised we would do. Because that's what you do. You tell people, if you vote to repeal, this is the legislation I'm going to introduce, and that's the task that we now have. I recognise very sincerely that there are deeply held views on all sides of this Oireachtas and indeed throughout our country. And in taking the next steps as an Oireachtas and as a government, we must respect and we must hear them all. I do think, though, language is important and language is insightful. And we've had many excellent contributions, and we've had excellent contributions, including from speakers who I have a completely different view from on this. I thought Deputy Mary Butler gave a very eloquent and honest speech in this House last night. A woman who campaigned against the referendum and was very upfront about her views, but also recognising the reality of the people's decision. And I thought she made a very important contribution last night. Unfortunately, though, some people still talking about this issue in this House are using language that is insightful about a mindset that is worrying. I've just written down a few phrases that I heard today. I've heard reference to those women. I've heard reference to a cooling off period. I've heard a horrific and bizarre reference to termination will replace contraception. Now, these sort of views are offensive, but they're also ignorant. They also show a lack of understanding as to the mind, the thought process, the very difficult decision that a woman goes through before accessing termination, and to in any way equate termination with contraception shows a fundamental lack of respect, quite frankly, for women, but also a fundamental lack of understanding about termination and indeed about contraception. So I do think, Laskin Corla, as we go to the next stage of this bill, which I hope we will in the next couple of days, I think there's an importance that we all use language that is respectful. They're not those women. They're women from every town and every community in this country who are looking for help in a crisis. And we need to be very careful that we don't use language that stigmatises. And I would really ask that we reflect on that. I would like to assure deputies that I have listened carefully to the contributions made so far. And I am pleased to note that, in general, I think there's very significant support for this bill in this House, though I recognise there's far from unanimous support. I am mindful, however, that issues have been raised around certain provisions in the legislation, and I do look forward to committee stage, when we will be able to discuss and address these concerns in much greater depth. I am aware, for example, that some deputies expressed a concern that the term abortion is not actually used in the bill, and I want to address that issue because I think it's an important one. The reason for that is this is the result of the wording inserted into the Constitution by the 36th Amendment to the Constitution Act 2018. The 36th Amendment inserted a new Article 43.3 into the Constitution, and that article states that, and I quote, "Provision may be made by law for the regulation of termination of pregnancy." Therefore, the Health Regulation of Termination of Pregnancy Bill is the means by which the Oireachtas will exercise its new constitutional authority under the new provision. In this way, the Oireachtas is carrying out the will of the people as expressed in the result of the referendum, and using the language of the new Article 43.3 in the legislation that seeks to give effect does provide necessary consistency and clarity in law. So what I'm doing in the bill is mirroring the language used in the new constitutional article, and therefore that's why we use the terminology in relation to termination of pregnancy rather than the word abortion. It ensures that the bill is consistent with the wording of the Constitution and avoids any potential doubts or indeed any unintended consequences which could potentially flow from departing from that language. So it's for that reason rather than any other reason. I'm also aware that there was some disquiet expressed around the positioning of the offences provision in the bill. And again, I get this. People pick up the piece of legislation and one of the first things they see are the offences. And I've heard from deputies very sincere views in relation to this and their view that could create a chilling effect. So the general scheme of the bill published in July provided for offences in Head 19, but the Office of Parliamentary Counsel, when they drafted the bill in 3 parts, they decided that under this arrangement offences are in the first part of the bill. So I want to clarify that this section was placed in part 1 of the bill for purely technical consideration by drafters as opposed to any policy or political decision. There was no other reason for placing it and certainly no symbolic consideration behind it, but it is indeed something I'm happy to look at with deputies here as we move forward. Several deputies have also raised the issue of safe access to services, and I want to thank them for doing so, because as you are aware, it is my intention that following the passage of this bill, services for termination of pregnancy will be a normal and lawful part of the Irish Public Health Service for women. I recognise, however, that these services carry a significant likelihood of demonstrations taking place, demonstrations which may be distressing and upsetting both for service users and for healthcare professionals. And I am concerned, and I need to say it again in this House, I am concerned that already we've had maternity hospitals like the Rotunda have to take to their social media channels to alert women to this very upsetting situation happening outside the hospital. I mean, when a woman is accessing a maternity service, going into our maternity hospital to have a baby or to deal with a crisis pregnancy situation, that woman and her family deserve to be able to access those services in a way that doesn't further add to their distress or their pain. So I do believe we need to act in relation to this, and many countries providing abortion services have included provision for safe access to those services in their legislation. In July, I sought and received government approval to draft legislative proposals to ensure safe access to premises at which termination of services may be provided. This would allow patients, service providers, healthcare staff and members of the public to enter and leave the premises without fear of intimidation or harassment, and without being subject to unwanted communications about termination of pregnancy by any means. This would include oral, written or visual displays like the ones we were subjected to during the referendum campaign. Whilst it was my original intention, as you will know, to provide for such safe access in the Health Regulation of Termination of Pregnancy Bill, in this bill, a number of issues were identified during the drafting process. So in order to allow for full consideration, I decided that we couldn't delay this bill, and that the best way to proceed would be for a separate companion piece of legislation. I therefore requested and was granted government approval to draft a separate general scheme of a bill to provide for safe access zones to services which may provide termination of pregnancy procedures. And work on this companion piece of legislation will be concluded without delay, and I would hope will be in place by early next year. Another issue I noted that has been the subject of concern by some deputies is that of conscientious objecting and the drafting of section 23 of the bill. Some deputies have suggested that the bill should not require doctors, nurses or midwives to refer a woman on for care where they have a conscientious objection to providing termination of pregnancy services. I would like to point out very clearly, because I think there's been a lot of misinformation in relation to this, quite frankly, I would like to point out that section 23 of the bill, as it is drafted, is absolutely in line with the current section 49 of the Medical Council's Guide to Professional Conduct and Ethics for Registered Medical Practitioners 2016. This obliges doctors to enable patients to transfer to another doctor for treatment in cases of conscientious objection. It's also in line with the Nursing and Midwifery Board of Ireland's Code of Professional Conduct and Ethics 2014. So let me be very clear. This legislation does not require medical practitioners, nurses or midwives to do anything new, or indeed do anything more than they're already ethically required to do under their own professional guidance. I am a bit concerned, though, that as everyone has raised conscientious objection, nobody's raised it from the impact of the woman. And we cannot have a situation where a woman finds herself going from a GP practice to a GP practice in search of a doctor. So I do think, and I've asked Dr. Boylan, and I've asked stakeholders in medical colleges when I met them in the last month, to consider the conscientious objection from the woman's perspective. How can the woman find out the information in a way that is safe for the woman, safe for the doctor? Because I can't imagine how awful the extra distress of a woman going before a doctor who has a right, absolute right, to conscientiously object, but that will add to the woman's distress. So I do think, while we talk a lot about it from the healthcare professional's point of view, and that's fine, and it's a legitimate issue, and conscientious objection is and will be provided for in this bill, we should also look at it, and perhaps more so look at it, from the perspective of a woman in distress, seeking help from the Irish Health Service. How do we help that woman navigate that situation to find the services that she needs? So I think there's something that can be done in that space as Dr. Boylan and others work on implementation from a practical and an operational point of view, and I'm sure we'll be discussing this much more at committee stage. Some deputies have also raised the issue of greater supports in relation to pregnancy in general, but more specifically for women in crisis pregnancy situations. In this regard, several colleagues pointed to the need to implement the ancillary recommendations made by the Joint Oireachtas Committee on the 8th Amendment. And I hate that title, ancillary, because I know it's only a word, but I know the committee very much had these as central recommendations, key recommendations, and sometimes we talk about them as though they're nearly add-ons. These are very much at the heart of what the committee wanted to do, what the government wanted wants to do, what the people want us to do. And we have seen in other jurisdictions like Portugal and like Spain, where they liberalised their laws in relation to abortion, but actually also put in place better services in relation to sex education, counselling, perinatal hospice support, contraception, crucially, that actually their number of abortions in their country declined. And I was looking at those figures not that long ago, and in both Portugal and Spain, you've seen a very consistent move in terms of a downward trend regarding abortions as you've increased the supports for people in crisis pregnancies, but also in trying to help people not find themselves in a crisis pregnancy situation. No woman wants to find herself in that situation. So I want to assure you all again that I am committed to working with this Oireachtas to reduce the number of crisis pregnancies, and this is part of ongoing work in my department. Work has been progressing on the development of more comprehensive sexual health and wellbeing education, information and promotion, and recent progress includes the formal launch and the ongoing development of a new website, sexualwellbeing.ie. This provides information on contraception, on crisis pregnancy, consent, relationships and sexually transmitted infections. A new Safer Sex campaign targeted primarily at young people was also recently launched using the hashtag #RespectProtect. And there is ongoing extension of the provision of free condoms to targeted harder to reach groups, including, for example, people living in direct provision. Regarding colleagues' concerns and legitimate issues about obstetric care in general, I am proud to be part of a government working with an Oireachtas which is committed, I believe, to the development of our maternity services. Over recent years, there has been a very significant focus on the development of national maternity policy in order to ensure that our maternity services are developed in a coherent and evidence-based way. Hard to believe we didn't have a national maternity strategy in Ireland till 2016, so all those who talk about the need to do more in this space, they don't tend to talk about it outside of referendum campaigns, sadly, but we do now have Ireland's first ever national maternity strategy, creating a better future together, 2016 to 2026. It was actually developed by the now Taoiseach when he was Minister for Health. We also have the HSE's national standards for bereavement care following pregnancy loss and perinatal death, including in situations where somebody has experienced loss through abortion. And HICWA has now finalised national standards for safer, better maternity services. And I think when we take all of these developments together, they are clearly key building blocks which will enable us to provide a consistently safe, patient-centred, high-quality maternity service. For my own part, I'm fully committed to ensuring that all women accessing maternity services should receive the same standard of safe, high-quality care regardless of where they live in this country. Every woman from every corner of Ireland should expect and be able to access the maternity services that she needs. Deputies will be aware, Deputy Burton rightly raised the issue of access to scans and anomaly scans. The Deputy will be aware that we are rolling this out now right across our maternity services and currently in the process of recruiting sonographers to ensure that this can be available in all of our maternity units. It's quite a process to get through all this recruitment, but we are making good progress, and I expect this to be available throughout the country by the end of 2019. Last October, I also launched the implementation plan for the phased rollout of this maternity strategy, which was developed by the National Women and Infants Health Programme. So we have a lot more work to do in this area, but we have before this House now a piece of legislation that fulfils the commitment that I made, with many deputies from across this House to the Irish people, that if they repealed the 8th, we would bring forward legislation which is largely in line with the All-Party Committee's report and is very much in line with the general scheme that was produced before the people of this country had an opportunity to vote. I'm pleased that we will now conclude second stage, and I look forward to progressing this legislation at committee stage. And I continue to think today of the 9 women who will travel from our country today, and the 9 more tomorrow, and the 9 the day after, and the 9 the day after, and the 3 women each and every day who will continue to access online abortion pills without any medical supervision. And it is for them that we will all put our shoulder to the wheel and work to pass this bill, and that the HSE will work with Dr Boylan to make sure that we can be ready to implement new services in this country at the beginning of 2019. Gur Magat.